internet went bad yesterday.
Ooh.
I know. What's up, everybody? Welcome to the Pain Sucks podcast, Facebook Live this morning. And we have an awesome topic, one that I've been polling people about for about a month, asking them what to do. And actually, believe it or not, tends to be the number one question people want to know about, and that is, what is CBD? And it's not just an oil. And with us today, we have a really close friend of mine, someone that I've gotten to know over the last 4 or 5 years. And this is Dr. Andrew Kidder. And believe it or not, he is a Chicago Bears fan who lives in Idaho, which nobody knows how that's even possible. That's another conversation for another time. However, in thinking about who I could talk to about answering questions for folks in pain about CBD, he came to my mind. So Drew, welcome to the Pain Sucks podcast, brother.
Thanks for having me.
It's good to have you here. I know that it's a little bit early your time. However, I think we're going to get a lot of people. In fact, I'm getting messages already from actually around the world, people watching and asking questions. And so we're going to try and get to your questions. We're going to go ahead and try to make sense of this thing called CBD, because I think that it's a buzzword. And we were talking before, there's a couple of buzzwords right now that make me mad. The first one is keto, because everyone thinks that they just eat an avocado a day, then they're keto, right? People don't realize how hard it is. And then the second one has become CBD. It's the new fix-all for everything. And while it is really amazing, we have to have a very clear understanding on what it is, how we use it, especially in relation to pain. And then my favorite one was the gas station the other day selling CBD. And I can't even imagine what crap that is. And so we've got to talk a little bit about quality. So let's just jump right in. Drew, let me just jump in, and why don't you give people a little your background, how you got to where you are today as a functional medicine expert of the world and got into CBD.
Yeah, so my background, like you, I'm a doctor of chiropractic. I practiced for 15 years. Absolutely love everything we do just from a foundational standpoint as doctors of chiropractic. And yet I started seeing a lot of things in my own clinical practices that I realized that people, I hate to say scratching the surface, but we were addressing kind of foundationally their issues with pain, right? People's perception of chiropractic as being pain relief. And that really, that hurt me, to be perfectly honest. And so I started looking at what else do I do? We know the broad reaching effects of chiropractic and a chiropractic adjustment, but how do I help people through their lifestyle? Through dietary modifications and through using good nutraceuticals and those types of things, nutritional supplements. And so I really delved into the world of clinical nutrition and functional medicine. Now I act in that capacity. I work in consulting, and now I have the pleasure of helping other practitioners, other doctors help their patients. And so you hit the nail on the head. I mean, CBD is one of those buzzwords, just like keto and paleo and everything else. But I think people lack sometimes the understanding of what it truly is, and right. that there's a lot of misinformation out there. And I use the reference that the world of CBD right now, even in a clinical perspective like yourself with seeing patients, is kind of the wild, wild west, because there are a lot of products out there. But you don't know what you're getting. So as you said, we'll talk about some of that today, what to look for, and hopefully have a little bit better understanding of how CBD works, what this activates in our bodies, right? And kind of where this is applicable, especially in the world of pain sucks and dealing, with chronic, oftentimes acute or chronic pain and disc pain.
Right. And one of the things that we want to make clear is that a lot of people are suffering in chronic pain. I think chronic pain is probably an epidemic now in all areas. And I know that there's people that are watching and people that reach out to me, and it's not just about disc. It could be cancer-related pain. It could be autoimmune-related pain. It could be other things. But I think that what I want to start with is understanding. So if you could if you could break down what CBD is for us first, then I want to talk about the pathway it uses, because that pathway is really kind of new science, the whole endocannabinoid, you know what I'm saying? I always love that word, but that system is kind of a new thing to science. So break down what CBD is for us, because while people are in pain, we also don't want people to become hooked on even something natural as a pain relief. We want them to heal. And what's really interesting about CBD is its ability to get us to heal. So if you could tell us what CBD is, and then if you could, Drew, just stick in there this idea of THC too, because I've already had some private Facebook messages of people asking for that. So we want to maybe break down just what it is, where it comes from. Let's start there.
Sure. So CBD is cannabidiol, okay? And cannabidiols are naturally, or cannabinoids are naturally occurring substances, naturally occurring compounds in the cannabis plant, okay? CBD is one of only approximately 100 cannabinoids that are found in the plant, in the cannabis plant. And I think, hopefully, well, whenever you want to discuss that, we'll talk about, this broad cannabis, because a lot of times
why don't you do that now? Do that now,
okay,
because that was a good thing. Yeah. What is cannabis?
So here's one of the fundamental problems with CBD, or cannabidiol, that falls under this umbrella of cannabinoids, right? These naturally occurring compounds, and that they come from the cannabis plant. Well, guess what? People immediately hear cannabis, and what do they think? They think marijuana. They think pot, right?
Right.
And that's true, right? That it is the same plant, but we look at under that cannabis umbrella, we have hemp and we have marijuana.
Right.
Now it all comes down to how it is grown. Is it grown for, high THC levels, which I do want to say, guess what? THC is one of those approximately 100 cannabinoids. So they first discovered, they were doing research for specifically THC. And that's when they discovered these receptors in our body that bind to, at that point, the first research was THC. But then they also found these other cannabinoids, okay, of which, again, one is CBD. So a lot of the gray area, to be perfectly honest, the wild, wild west in this CBD industry is where does your CBD come from? Because marijuana has CBD. It also has THC. THC is the psychotropic component, the psychoactive component that elicits the high that is associated with marijuana. Okay?
Right.
Whereas hemp can or cannot, and we'll talk about different sources, can or cannot have THC as well.
So if you think about an umbrella, you've got cannabis, and then you've got your little branches where you've got your marijuana plant, which is going to contain CBD and THC. And these are the two of the 100 that we're talking about today. I can't wait for science to figure out the rest. It'll be great. Whereas THC gives you that high, and then you have your hemp on the other side, and that may or may not, but that's where we're really going to be leaning as far as where we're going towards the CBD conversation today.
Yeah, so that's great to think of it in that way, because it is under that umbrella of cannabis, but typically the form of cannabis that we're looking at for CBD is cannabis sativa. Okay, you can walk into, a lot of the states where some of your viewers are tuning in, they may be able to walk into a dispensary that is carrying like cannabis indica, which is a form of marijuana. So you have that umbrella that is cannabis sativa, cannabis indica, several different forms, and then you have hemp, marijuana. It's kind of like citrus. We could say a classification of fruit is citrus, but we have, grapefruit and oranges and lemons and limes and tangerines and all of those. And it would be like saying that all of those have the same, compounds, all of those have the same flavor, right? Because is all citrus sweet or is all citrus tart? No. So we have to look at that, kind of in that same perspective with cannabis and with CBD.
So as we move forward today, we're going to be focusing on that cannabis sativa side, that CBD side.
Right.
However, there are places, in Illinois being one soon, where THC will be legal. And so real quick, just touch on that real quick. Is there a medical importance of THC mixed in with CBD that could help someone in pain, or do we just really need to stick with the CBD side for the medical benefits, and THC just is going to elicit that high? Is there a driving factor to THC? Anything exceptional about it?
That is a major topic of debate and research, whether THC has to be present in some capacity for the activation of CBD. Okay. And that's why we deal with several different sources, several different types of CBD, which we'll expand on later, but that we have CBD isolates, which have no THC. We have full spectrum, and then we have broad spectrum THC. So there are people, depending on what clinical application you are looking at, that there are people that say that you need to have some level of THC. And it's because of how they activate these receptors that we have in our body. Here's the cool thing. Guess what? Our body has CBD receptors. So what is activating that? Is it activated by THC, or is it activated by CBD, or is it activated by one of the other endocannabinoids like CBG, CBN? The list goes on and on and on.
So not to get confusing, let's just wrap this thing up. There is a God-given system in our body that actually binds these cannabinoids, particularly these CBD and THC are the ones being studied right now. But we know that there is an actual place for this plant to actually interact with our body, which is really interesting. And then, there's legalities and there's all kinds of FDA regulations and whatnot. So let's just end with the science there as far as like THC, CBD. I think the people, especially me now, have a real good understanding of how this is broken down. Let's go into let's talk about how we get CBD. And maybe this would be a good time to talk about noticing quality of CBD.
Sure. So I want to touch on, not to digress or not to
digress all you want, man.
You mentioned this system in our body, and the system, and sometimes people, hear about that, is what we refer to as the endocannabinoid system. The endocannabinoid system was discovered in the 1990s. And here is the cool thing. Like you said, this is a God-given system in our body. It's there for a purpose. And its purpose is to maintain, what do you think that is? What do we talk about in chiropractic all the time? Homeostasis, or balance, right? And so the endocannabinoid system has the highest number of receptors of any other system in the human body, greater than our cardiovascular system, our endocrine system, which is our hormones, our nervous system. There are more receptors in this endocannabinoid system than any other. And so I think that speaks to its importance in the body, because guess what? It is helping regulate these ups and downs of hormones, these ups and downs of neurotransmitters, the nervous system, what have you. And what is cool, endo, meaning inside, right? The endocannabinoid system, we also have endocannabinoids, which are naturally occurring cannabis-like compounds that our body produces on its own.
Yep.
So again, that infinite wisdom, do you think maybe if our body has a system, it also has a system to where it produces these molecules to create balance or homeostasis? There is some validity and reason why it is there. My answer would be yes.
Yeah, absolutely. So as we talk about this system and then these molecules and then of course CBD, it's really bigger than pain. It's really has this amazing opportunity to bring balance back to us. So let's talk a little bit about CBD and how it interacts with the body. And let's talk a little bit about where it comes from and the quality. So I'm just going to be quiet and I'll let you chat through it. And, and I think this is the part where we're going to bring great value to people, especially those listening, to why they should be taking it for pain. Like last night, I took a soft gel. I didn't have any pain before bed, just for homeostasis and for balance. And I know a lot of people that are doing it in different forms. So let's just start with how it works in the body. And let's start with how we get it. I think it's interesting, like where do you get the CBD from, like the process of it, and then how it might relate to the pain management system.
Sure. So just to kind of expand a little bit on those endocannabinoids, right? We have two primary endocannabinoids, again, which are cannabis-like molecules that are produced in the human body. We have two types. We have what are called anandamides, okay? Big fancy word, anandamides. But an anandamide is a neurotransmitter, a brain, communicator, if you will.
Brain chemical.
It is, brain chemical. It is commonly referred to as the bliss compound. It is a mood enhancer. It stimulates moods like joy and happiness. It actually creates what we get. I shouldn't actually say what we get. I have a motto of don't run unless chased.
Yeah.
But it creates what is called the runner's high, right? Yeah. That euphoria or that bliss. The second endocannabinoid is something called 2-AG, and 2-AG is the most prevalent endocannabinoid in our body, and that is what is responsible for pain and immune response, anti-inflammatory benefits, and even appetite. Right. So awesome. we see that there can be benefits to CBD for appetite and for weight loss and that type of thing. So you hit the nail on the head. It's not just about pain. We can use it to create, and our body naturally does use it to create this feeling of happiness and joy, and but then also the great anti-inflammatory and anti-pain benefits.
Love it. And now this is not the pathway that's going to lead to Doritos afterwards, right? And this
what I think is funny, is ironic, is when I say that, oftentimes you get people that say, oh, that explains why with THC being one of those cannabinoids, why THC may stimulate the munchies, right, with people. But it is that system in our body to create that balance between hunger and satiety. So just quickly, there are two, so we look at these naturally occurring, endocannabinoids. We look at these external cannabinoids, of one of which is CBD, others like THC. But what do they activate? Well, they activate these receptors in our body, and scientists, man, they're brilliant, aren't they?
Yeah,
they
absolutely.
come up with the coolest names for things in the human body. So there are two primary CBD receptors. You want to know what these names are?
I do.
CB1 and CB2.
Oh my gosh, brilliant people.
Pretty fancy.
Is that Latin, by the way?
Yes, that is Latin. Yes.
Okay. Yeah.
CB1
awesome.
and CB2.
Okay.
So CB1, the largest number of CB1 receptors are located in the brain and spinal cord. Okay. They regulate things, like I said, like memory and appetite and pain, right? Decrease pain. The other ones are the CB2, and CB2 receptors sit more in what are called peripheral tissues outside of the brain and spinal cord, things like our gut, things like the liver, the kidneys, all of that. They're heavily involved in the immune system, regulating immune function, and they're highly involved with reducing inflammation, which we know that inflammation is the driver of numerous disease processes. But with your viewers, when we talk about pain, how much of an inflammatory component is there with pain?
Absolutely, especially with disc injuries and nerve problems. I think that inflammation is the number one enemy. Right. It's not even the disc. It is the enemy is inflammation. So what you're telling me is that our body has already pre-programmed a bunch of receptors and pathways that do their own thing, but that by finding this thing called CBD and even a little THC, we can actually now activate these receptors to participate at an even higher level and regulate balance even better for us. Is that what I'm understanding?
Correct. Absolutely.
Awesome. So CBD, we've got our cannabis plant, and we are going to harvest it and dry it and do what to get to a pure level of CBD? What are we going to do to it?
So there are a lot of steps in that process, right? You look at, especially where I live out west, we have large numbers of growers in Colorado and California and Oregon. East Coast, believe it or not, one of the biggest growers is Kentucky, but it does make sense because of even them growing tobacco, plants.
Right.
But they take that, that crop, and they basically harvest that crop. And the first process is extraction. How do they extract the actual CBD or the different constituents or components from that? And one of the probably easiest and safest, I don't really need to get into the science of how that process is done, but they use something called CO2 extraction. And CO2 extraction is one of the easiest and least harmful ways to extract CBD from the plant. I think one of the things that we do need to talk about is CBD is can be a very, very dirty, filthy, pesticide, herbicide, fungicide laden crop. And what is interesting to me is, the number of people that I speak with who they themselves take part in a really clean lifestyle, clean eating with all organic, produce and organic meats, but then they don't look to see the sourcing of their CBD products, right? And in some cases, even people, their marijuana products. And it is, something that you have to look at down to the source of the seeds, the organic seeds, the farm that it's actually grown on. Just because it is now organically harvested doesn't mean that field or those fields were previously, clean organic fields. They may still deal with pesticide residue from decades of conventional farming. Right. So taking that raw crop and extracting it, the next process is refining that down to the actual CBD product that is going to be put into maybe tinctures, liquid that you put under your tongue, or capsules, or topicals, or as you referenced, gummies, things like that. And there are a lot of different methods of administration for CBD. Obviously, one of the biggest, industries that's taking a huge hit, which I've never been a proponent of, is the vaping of CBD. And obviously, because of all the scrutiny of safety of vaping, that is something that is going by the wayside, as a method of administering CBD.
Right. So I love that you broke that down pretty simple. I know that it can get very, very complicated when it comes to how we start with a seed and move forward. But let's just keep it super simple then as we move forward here. And at the very end, we'll give people an opportunity to just reach out to you directly for a source. But
Sure.
there's so many people on this bandwagon, and there's good and there's bad. Don't get me wrong. There is good. I'm pretty sure I'm not going to buy the stuff at the gas station.
Right.
But there's a lot of really good stuff out there. But is there a couple of tips that you can give to folks who might have a family member that's an MLM or might walk into a store or whatever? What can they, because you're not going to get the background on the field and all
Sure.
the, where was it grown to see, but what are we looking for? I mean, mostly I tell people, like, if it costs you, under $50 or $60 for a bottle, you probably have crap. But what do I know? So maybe give us a tip or two, and then I want to move into application, especially in relationship to pain, because I think listening to you for about 25 minutes now, we should all be experts.
Yeah,
I don't know. Really, really good. This stuff, no, it's really, really good. So maybe give us a couple tips on what to look for.
Yeah. So, one of the things I think we do need to kind of look at is the different sources of the different forms of CBD. And really, there are three primary forms of CBD. There is CBD isolates, which literally is just extracting that one cannabinoid, which is cannabidiol, CBD. And it is, as the name implies, it is isolated. It contains no other cannabinoids. It contains no other what are called terpenes, which are organic compounds that really give the cannabis plant the smell and the taste, which is kind of cool when you look at the science of it. Not really even the science, the nature of it. Those are naturally occurring compounds that are self-protective mechanisms for pests.
You're talking about terpenes.
Terpenes, yeah. So that is what gives kind of that smell and taste. Right. Well, CBD isolates extract all of that. But there is a lot of kind of scrutiny, a lot of discussion of the best method of administration of CBD isolates. And there are some resources that say that CBD isolates are best if they are smoked or vaped, which a lot of people are certainly not going to take part in for understandable reasons. What is interesting, because I think they know the clinical benefit, is, of course, Big Pharma wanted to get involved in the CBD business. So they basically patented, through a company called GW Pharma, they patented CBD isolates. And there are people that are looking at, well, why would the pharmaceutical industry want to do that? Do they want to try to create a drug, which they are doing, that is a CBD isolate? Or really is their motive behind it to prevent the utilization of just kind of over-the-counter CBD products? Right. And I think a lot of people point more at that. They don't really, there's not enough money in it for them, even though there's obviously money involved. It's not big enough for pharma. So let's just let's control that. Gotcha. So there are people that absolutely want CBD isolates because they know that there's not going to be any THC in that product at all. But I think it lacks some of the other kind of the synergy of the other cannabinoids and the terpenes that may be involved for clinical benefit. Yep. Excuse me. The second form is what are called full spectrum CBD, which full spectrum CBD contains obviously the cannabidiol, but it contains a lot of other cannabinoids, and in some cases can actually contain small amounts of THC. This is where we talk about, and I am by no means, and I want to make this perfectly clear to your audience, I'm not an attorney. I don't make any legal claims whatsoever. But on the federal side of things, the federal legal limit for THC is 0.3%. So that is 0.3%. In some states, like where I am in the state of Idaho, they basically say 0% THC. So someone has to be very careful if they are in a state that does not allow that federal legal limit, that they may have a full spectrum hemp, full spectrum CBD product from industrial hemp that contains maybe higher than that legal limit, or even somewhere between 0 and 0.3%.
Okay.
Lastly is what are called broad spectrum CBD. So broad spectrum, in some cases, people look at it as almost a combination of full spectrum and isolate, because it contains CBD, a lot of the other cannabinoids, as well as the terpenes, but it doesn't have any THC at all. Now, what's funny is there are people that say, well, we have a full spectrum hemp oil product, but it is THC free. They extract, and you can extract the the THC out of that, that CBD product, but in essence, that's making it more of a broad spectrum versus a full spectrum product.
So Ashley asked us earlier, is there some without THC? And you're saying yes, isolate
Absolutely.
don't have THC, and broad spectrum aren't going to have THC. Now, are these things that people can see on labels or going on websites, that this stuff is like listed there for them to understand the terms you just used?
Yeah, you typically want to look for a source that says, maybe it's just in their product, their name, that they say full spectrum hemp oil or broad spectrum hemp oil or CBD, isolate. It should be there. It should also, typically be in the supplement facts when it shows the ingredients. They typically are, supposed to, if it's a legitimate company, they're supposed to say what the source is of CBD. So sometimes it lists as the primary ingredient full spectrum CBD, and then they may have in parentheses cannabidiol. Okay, so you should be able to look at that and know what you are getting. Okay.
Gotcha.
They also, outside of CBD isolates, which, as I said, shouldn't contain any THC. They should typically say on the label if it is THC free. They may also list other things, non-GMO, no pesticides, what have you. I think an important thing to look at is any company that is producing a legitimate, transparent product should make available to you what are called COAs, or certificates of analysis. And a COA should have what that raw material is, and then the testing of what exactly it contains.
Gotcha.
And one of the things to look for certainly is the THC.
Gotcha.
Is it listed as an actual number, or does it just show ND, which is, typically lab terminology for non-detectable, right? But I'll caution people, that can come down to the sensitivity and specificity of the lab, right? Because what if you're looking at, say, just may not be a great example, but the National Institute of Health lab, right? The federal agency, their sensitivity and specificity may be much better than, Dr. Matt's lab in Illinois. And so you may test it in one source and it may say non-detectable, but you take that same sample to another lab that it may be 0.0001%. So is that truly zero THC?
Perfect. So we know the difference now between isolate, broad spectrum, and full spectrum. Quick, give me 2 seconds on, is there a benefit to leaving in a small amount of THC in your Dr. Drew expertise of that full spectrum, knowing that 0.3 or below is not going to elicit that high response? Is there a benefit to the full versus broad or isolate?
2 seconds?
Yes.
I'm kidding.
23 seconds.
23 seconds. You know what? I'm going to give you my 100%, honest Dr. Drew opinion. Yeah. I don't think there is enough clinical, research out there to point one way or another. Because one thing is the majority of studies are animal studies, not human studies.
Right.
And I think there also is that part of it, that it is very subjective, because people will say, I took a product that had, a little bit of THC, maybe it was 0.1%. and they felt like they got better results than a CBD isolate. My opinion, I think in most clinical cases, people are better with a full or a broad spectrum versus an isolate product.
Yep, I agree. And I just wanted to hear you say that, because if there is true science talking about THC actually helping drive that CBD, and we're not going to get the side effect that, like, even though Ashley's question, but a lot of people ask me, what's THC? What's THC free? Well, like what we're saying is that it's all basically THC free. However, the full might actually have an added benefit, and yet we're still doing the legal thing according to federal guidelines. And so looking to full or broad would make more sense than isolate, in my opinion. Let's switch this real fast, Drew. So there's people watching, and there's going to be people, this is called the Pain Sucks podcast. And so, sleep is important, and gut health is important, and healing, and all the wonderful benefits of CBD. But let's spend 2 minutes on pain, particularly nerve pain, particularly disc pain, back pain, things that, what can we do with this? So we know that, perhaps a company we're looking into has a wonderful full or broad spectrum product. Maybe we don't like the taste of the oil, or there's liposomal and regular, and there's gummies. So where are we going to go with this for people?
In terms of pain?
Yeah. So like I use it topically and orally, right? With my back and with my disc. So let's just talk through what your thoughts are in terms of pain management.
I absolutely love your approach, and it's typically an approach that I recommend for people, especially with pain. I think the other categories, looking at it for anxiety and relaxation and stress, using it orally, whether that means a tincture, a liquid, or a capsule, or a gummy, or whatever, that to me isn't as important, the method of administration. But when it comes to pain, I think you hit the nail on the head. I think we need to address things both from a systemic standpoint as well as localized. So taking an oral product that is going to activate all of those, especially in the case of pain, acting on those receptors that are in the brain and spinal cord, those CB1 receptors, you're not going to do that with just a topical, but you may get, localized anti-inflammatory benefits, reducing inflammation from a topical form. And we see a lot of really good kind of case studies with people that say, yes, for condition X, I take a capsule. Right? People with irritable bowel syndrome may do better with a capsule than they do with a liquid, just because of its method of delivery getting into the gut. But for your audience with pain, I really like the kind of the double whammy effect of let's reduce localized inflammation, let's drive some localized pain relief, some nociception, and take it systemically as well.
So real quick, so tincture, liquid, capsule, gummy, I mean, we're talking about the same amount of CBD. I mean, assuming you measure it correctly in the little dropper, but
Sure.
But what about that delivery system? Like, for instance, the soft gels, I like the soft gels. The gummies are wonderful, and we're not talking about edibles. We're talking about gummies. But in my experience was that, and actually you gave these to me, was using the CBD like rub, right? Which had some essential oils we talked about on a different podcast that help with inflammation. And I literally just every day would take a nickel size and just right over the injury area of my back. I know a lot of people listening, their pain is in their leg, right? Or their arms, even though the cause of the problem is in their spine. And so I'm putting it right over the area of the spine, even though my back didn't hurt.
Sure. Because
I want to handle the inflammation and the regulation all there. But then I was also taking the liquid. So that's my recommendation. I feel like I hear you saying the exact same thing. It's a double whammy. What about dosing? I know it's different for everybody. Any sort of, people call me and go, hey, I got my bottle. Like, what do I do? And what people also think is that, like, Norco hydrocodone kicks in about 20 minutes, right?
Right.
But things that are natural sometimes take a long time. And I feel like people also give up after 4 days, right? So can you talk a little bit about dosing for pain, and then, like, just being patient and understanding the body's, first of all, you're activating a system you've probably never touched. Right. So you need time, but can you just touch on that real fast as we wrap up?
Yeah, I think the challenge is, dosing. There's so many factors associated with that. The factors that come into play are, the method of administration. Are you, orally taking a liquid or a tincture is going to be faster getting it into your system than swallowing a capsule. Okay, so people may notice, even if they're taking it for pain, they may notice immediately within 20 minutes, kind of this, right, kind of lowering the stress. And here's the reality with that is it may not be what they're taking it for, but that at the same time, and you can attest to this, how beneficial is that to sometimes just breathe when you're dealing with pain? Right? Just to kind of relax the entire system that is currently in a state of excitation, because you're thinking mentally, am I ever going to be pain-free again? And the answer is yes, you can be, right? But how beneficial that is to activate both of those receptors for mood as well as anti-inflammatory and pain. Right. So, dosing is challenging. I tell people, as with anything, me, when it comes to supplements, start low and slow. Don't do a high dose if you don't really know what your body needs. So dosing, sadly, like you mentioned, the gas station product. I just had a clinician reach out to me recently that said, oh, we bought at a convenience store, we bought a bottle of this liquid in Eastern Idaho or Western Utah, and man, it didn't really seem to work. Well, 1 ml dropper, right, a full dropper, which typically they come in like a 30 ml bottle, 1 ml was 5 milligrams. Well, for a lot of people, that's not going to scratch the surface, right? It's not going to really help. Whereas typically, and again, numerous factors go into this, usually the lowest dosing as a pain and anti-inflammatory benefit is about 25 milligrams. So, you may be wanting to look at a tincture, a liquid bottle that is like 750 milligrams of CBD in that 1 ounce bottle, because then every 1 ml dropper, not dropper,
a whole dropper
is going to be 25 milligrams.
Yep.
Other people may need 50 milligrams. What I think is beneficial too, there's a lot of kind of support behind micro dosing throughout the day, and that some people may need to take it, 2 or 3 times per day to get the desired clinical benefit. But that's where I love the synergistic side of it too, with using a topical, because maybe the topical can be used, easier and less intrusively than, having to, if you're sitting at your desk at your office or wherever, pull out your bottle, and put a dropper in or take capsules or something like that.
Can I overdo it? Can someone overdo it?
Absolutely. Yeah. Even though it is a natural compound, right, coming from a plant, a phytochemical, you can absolutely, overdo it. Since there's not going to be the THC, the psychotropic effect, it's not like you're going to get a high from it, but sometimes people may notice that they get, they're a little more tired, because of how it's activating that mood receptor. They may get a little bit of GI, some digestive upset, from it, depending on how, sensitive. So that's why, again, going back low and slow, start slow and give it time. You nailed it. We expect for a lot of natural compounds to act like drugs. And, the reason why so many people are using CBD for pain is because they're getting off of these harmful opioid, medications, the oxycodone and Norco and things like that. So yeah, I think I always like for people to start with a lower dose. Okay. And if they don't get the clinical benefit, they can up it. There's not a hard and fast rule of you have pain, right, 200 milligrams, right? It's not like that at all.
And everybody's different and they'll find their own way. But I think the thing is that you've got to try. You can't go, hey, I bought a bottle of CBD at Walmart and I took it till it was empty and I got no help. Well, did you buy the right stuff? Did you buy the right quality? I love the idea of like, hey, 5 milligrams in a whole dropper. I mean, there's nothing to that for you. You're not activating anything. So having like that reference point of 25 milligrams, following directions on the bottle as often as it says, and understanding good quality is everything. So I love that. Drew, and as we wrap up, anything else, like any over general statement? I'm going to post this like everywhere today. So hopefully people will just sit and listen, because there's, we don't want it to be a buzzword. We want people to have a clear understanding, whether they want to know the science or not. Just this last 5 minutes of what you talked about was everything. What do you want to end with?
Well, one, you can't always look at it. You do have to look at quality. You have to look at quality. You have to look at sourcing, all of those things. When you and I first met years ago, when we started talking about this whole world of nutritional supplements or nutraceuticals, do you remember what I said when it came to, a response with so many people saying, oh, that's expensive, right? What's the most expensive supplement? One that doesn't work.
One that doesn't work.
Right.
Yeah.
And so you also have to, what works can be very, very subjective. It may take time for this to truly activate from an anti-inflammatory benefit to where you are seeing the clinical results, the clinical benefit. So give your body time. I tell people with CBD, look at it and go, I'm probably going to go through a couple of bottles before I really start seeing the noticeable improvement. That may be faster for some people. But I do like the approach, as you said, for people that they may have the more pain. Cool. I'm working with some doctors right now that are getting amazing results with using CBD with neuropathy, pain, people with severe tingling, burning, numbness in their feet. And they're hitting both spots. They'll put it on their feet for that localized effect, but they're putting it also on their lumbar spine, on their low back, where really the root, oftentimes is coming from.
I apologize to people. My internet's starting to, it dropped a little bit. So you've
looked a little fuzzy for about 20 minutes now.
Yeah, the audio, and it's just that Naperville and Comcast and Xfinity, right?
You still have like crank up dial-up in Naperville?
Yeah, I should have just done the plug-in dial-up. Anyways, Drew, I want to say thanks, man. So listen, the one thing what we were trying to avoid, which we did a good job of, is we don't want to point people to we didn't really want to promote, right? This was educational. We wanted people to have a wonderful experience learning today. But I do think that having a great resource is important. And so you had told me what you would like to do for people. You want to go ahead and just let them know, and then we'll put that in the show notes?
Yeah, there are a lot of great sources. I'm totally open to, people sharing, saying, hey, maybe someone's involved in a company that that has recommended a particular product. I'm never going to, for lack of better terms, bash a product. What I do want is to see transparency with their testing, their quality, everything else. But I'm more than happy to look at that. I'll share my email address, and I can even share a resource or a couple of resources where people can buy good, high quality products. So if anyone wants to send me an email directly with, I would recommend putting in the subject line, pain sucks, right? So I know that you're coming from Dr. Matt's podcast, and then, that'll stand out in my email. But you can send an email to Dr. Drew Kidd. That's DRDREWKIDD. Make sure it's 2 Ds @gmail.com. So Dr. Drew Kidd with 2 D's @gmail.com.
I just put that in the comments.
Okay, awesome.
Yep.
Be happy to, answer questions for you guys that you may have specifically and guide you to some good resources.
Hey man, this was awesome. I mean, from start to finish, I know I learned a lot. I guarantee people learned a lot. This is going to be super popular because it's not just, hey, what do I take with this answer? It's let's let you understand why and how, because I think that like what Mandy and I were talking about earlier this week when this airs is the importance of our mind and this understanding and this hope, so that learning what you taught us today is going to be everything to how this works. So thanks for being up early with us today.
Early. And, this is late.
This is late. I'm sorry. You were probably at the gym at 3 a.m.
No, I was at the gym at 5:30, but that's all good.
Cool, man. Well, I'm going to post this everywhere. I'll share it with you. Thanks again for your stuff. And guys, this was the Pain Sucks podcast. We hope that we're bringing value to you. It's on YouTube. Go ahead and share and subscribe. We're going to be on Facebook Live for just about everything we're doing. And then, of course, these will air on iTunes for our podcast called Pain Sucks Podcast. And we just appreciate it as we build this one location resource for all things having to do with pain and healing from pain. And so if you have anything, reach out. Otherwise, Drew, have an awesome day, brother.
You too, buddy. I appreciate you.
Thanks.